Hi, I'm Dr. Tim Wood from Mission Family Chiropractic. I wanted to talk a bit today about why we check children for subluxations and why we adjust children when needed. And also we'll show you an example of what that looks like when we check a child as well. So I wanted to talk a bit about why. Because I know for a lot of people, if you experience chiropractic care as an adult, more from pain relief or for a specific health problem, it can be hard to understand why children would need to get checked, especially if they're not having health issues or pain. Also, it can be hard to understand how a child would get adjusted or if it would hurt and those types of things. If you've experienced really manual adjustments, then you would picture that happening to a child. And again, that can sometimes be a question people have. So I know in our office, we focus on pediatrics a lot because it's surprising how many of the adults we see had problems as a child that we can see through x-ray or posture that developed into the problems they're having as an adult. So it makes sense to me that we correct the problem in a child and keep them at their best so they have their potential to be at 100%. So why we check newborns specifically, research is really clear that through the birth process, when there isn't intervention like cesarean or forceps or epidurals, things like that, in an uncomplicated delivery, over 60% of newborns have misalignment of the top vertebrae in their neck specifically, often because the head is used to pull the child's shoulder out or because of the position in utero or being in the birth canal with their head in an awkward position. So that's one of the main things we're checking a newborn for is their upper neck alignment, because misalignment in their upper neck has an effect on blood flow to the brain. It affects the nerves going from the brain to the body, which obviously can affect almost anything. We see that relating to immune function, to things like colic, reflux, digestive issues, development in general. So checking kids and especially newborns at birth is really important for that. With kids in general, I have 3 children, and I just know that if they're sitting in car seats with their head to the side sleeping or when they have falls, it can cause a subtle misalignment called a subluxation. And if we correct that, it corrects very easily, then we prevent the issues that subluxation would cause over their lifetime as it gets more significant and has more impact. So it makes sense to get checked regularly as a child and adjusted when needed. And it's important the adjustments are done in a way that's very specific for children. I've done special training in pediatrics and we focus on that specifically. So how an adjustment is done, one of the questions is how safe is it? And it's really important to understand with newborns specifically, we're using very little pressure, usually a few ounces of pressure, which would be like checking the ripeness of a tomato or a peach. So very little pressure is used, but when it's in the exact direction of the facet joints and exactly how it needs to be done, it corrects the misalignment. The child often doesn't know anything's even happening, so very comfortable and certainly very safe. With children in general, research is really clear that adjustments are very safe. They've done research looking at millions of kids getting adjusted, looking at side effects, and the side effects that would happen would be things like tenderness or soreness. And even the risk of that was found to be less than 1 in 185 million adjustments to have any side effect at all. So it is very safe, very comfortable, and you know, kids love getting adjusted. In our office, they'll fight with their brothers and sisters to get on the table first. So that's why we adjust them. That's what it typically, or how it's done, what it looks like. And we're going to show you a video of me adjusting a child as well. So we're checking Gloriana, who's 16 months old.
Hi.
Hi. Good girl. So Gloriana is clear. She doesn't need any adjustments. which means that her adjustments have held from a few weeks ago, which is awesome.
Yay.
So Tanya, if I were to ask you why you get your kids adjusted, because you've had all 5 of your kids adjusted for many years, what would you say?
Well, for overall, the health they've been in has been considerably better since prior to care. They've needed a lot of antibiotics and a lot of doctor visits, and this is just been huge difference.
Awesome. Awesome. Thank you. Thanks, Mariana.
Bye-bye.
Bye-bye. So this is an adjustment that we'll be doing with Mackenzie. You go on to your left. Now onto your stomach. Look to your left and your right and left again. And look straight down. Awesome. All set. Thank you for watching that video of why we adjust children and also how we adjust children. If you have any questions, please go to our website, www.missionchiropractic.ca. There is a tab there for children and for pregnancy, and you can watch videos, you can read articles, and you can learn more. And most importantly, if you'd like our help, please give us a call or email us through the website.